All right, so Debbie, could you take it away?
Absolutely. Thanks, Matt. Thank you as always for your help. Okay, so this is the slide that I was referring to that has kind of an assortment of different kinds of community resources that people can access. And I'm gonna just kind of cruise through since we lost a little bit of time. And these are the basic categories that community resources and services fall into. Transportation, food delivery services, in-home services, which will include out-of-pocket things like housekeeping, assistance with shopping, and those are services that some people may have had in place for a long time. Case management and financial services, medical services like physical therapy and occupational therapy. I would also add speech therapy there, and we'll talk more about these. Nonprofits and other organizations, as well as websites, are fantastic resources, and we've all spent way too much time on the computer in the last year and a half, but there is some very good information and services out there. And we're going to talk about the Atlanta Regional Commission, the National Library Service, the Dementia Action Alliance, online sites and apps such as one called Lots of Helping Hands, and the Alzheimer's Association. So in general, I'm going to go back for a second. In general, what I want to say about these services is that it's a good idea to make use of a variety of services before you actually need them. So if you are a person with a mild cognitive impairment or a loved one helping out somebody that has a diagnosis, I strongly encourage not waiting until a medical provider says it's time to stop driving to actually try out different sorts of transportation services. Likewise, food delivery or other services listed here, because if you wait until you're in dire need, it's a lot harder to get used to these things or to kind of do trial and error and find the one that you want, like the best. So you can be a much more informed consumer by starting your search and trying them out before the fact. So transportation, in the past few years, Uber and Lyft have really taken over the role of the traditional taxi cab. But traditional taxi cabs still do exist. There are taxi companies that you can look up in the yellow pages, which also still exists, and actually call a taxi if you want to ride. But the rideshare services are certainly the most popular type of service for transportation. Friends and family, neighbors, even kids and grandkids who are relatively new drivers. This is a great way for them to practice as long as they're safe on the road. And transportation to designated locations like senior centers. Also, some of the county senior centers do have funding for transportation. They may have vouchers for vans and rideshare services. And the other thing I want to say about these rideshare services like Uber and Lyft is that there are services which will allow you to use Uber and Lyft, even if you're not comfortable using a phone or a tablet to call a ride. There are programs in Atlanta. Common Courtesy is one of them. And then the other one is administered through AgeWell Atlanta, which is a program of Jewish Family Services. and they have a relationship with Lyft. And these offer you the opportunity to have a monitored ride. So someone will make sure that the ride actually picks you up punctually, gets you to the designated location, comes to get you after the concert or the appointment. And it's a lot more comfortable for some people than just relying on the phone or the tablet. Also, there are many reasons that people might not want to drive themselves. It's not always that driving has become too complicated a task or driving is not safe anymore. Sometimes, it's raining and you just want door-to-door service without having to deal with a parking lot, or you might not be familiar with the location that you're going to, and you just don't want to sort out directions. So transportation services, including rideshare, are a very helpful thing to try out before you actually need to rely on that. Food delivery services, these have really blown up in the past few years, especially during the pandemic when people were not especially comfortable going to a store themselves. So the first category is meal kit services. There are many of these and they compete with one another, and there are often coupons or deals for new customers. So this website here at deliveryrank.com has ranked the best services in Atlanta. Some examples I listed were Blue Apron, Home Chef, Freshology, Sunbasket, Purple Carrot. Another one is HelloFresh. So these are where you would choose the menus that you wanted, things that appealed to you and might meet your own dietary needs. If you're a vegetarian or you need low salt meals, or you might have diabetes, you could choose meals that accommodate your needs. But the meals will come raw and not assembled. And they do take different amounts of effort and work and mess to actually put them together. So they're especially good if, if you don't want to buy a whole big bunch of parsley, they're going to give you just the right amount for the recipe and you're not going to have a lot of waste. And they're good if you, are kind of jaded and can't come up with creative ideas for your household. And some people use these, just for ease of preparation, and they are quite tasty, and you find the ones you like the best. Grocery delivery services, a lot of stores have these now, and again, they're ranked at atlantaparent.com, Instacart, various individual stores, Kroger, Publix, I believe Costco does it, Amazon Fresh, and a company called Shipt, where you do have to pay a membership and you have a personal shopper that actually calls you from the store if they don't have the item that you want, and they're working for tips. So these are good services if you can't or don't want to go to the store yourself. Restaurant meal delivery services, these have been around for a long time. When I was a kid, it was just basically pizza or Chinese food that would deliver. Now we have DoorDash, Uber Eats, and Grubhub that will basically bring you anything from anywhere. In-home services. So these are typically things that you will pay for out of pocket in the first category: housekeeping, assistance with shopping, meal preparation, assistance with bathing and dressing. But I will say that for folks who are in the lower income categories and need help with these things, you may qualify for an aide to come and help with these kind of things, you can contact Empowerline, and that information is going to be a few slides later. Allied services like physical therapy, occupational therapy, and speech are typically ordered by a medical provider. So at your annual wellness visit, your doctor may say, I'm worried about your gait, and I think we need some fall prevention exercises, and I'm going to order some physical therapy for you. Speech therapy is particularly good for some of our members that have difficulty with word retrieval or sentence formation, tip of the tongue kind of things. Speech and swallow therapists can be very helpful with more fluency of language. Usually speech and swallow has to be rolled in with physical therapy or occupational therapy. They won't come out just for speech and swallow. These are also services that may be ordered after a hospitalization as part of home health. Case management services. I do want to touch on geriatric care management for a moment. There are different types of geriatric care managers. Some have a nursing background, some may have a social work background, and depending on what your needs are, if you want somebody that's going to be able to drive you to doctor's appointments and go in and ask questions and take notes for your family members, or to make sure that the medications that you're on are not causing side effects if you take them together, you might want somebody with more of a medical background. If what you need is to make a plan for where am I going to live when my home gets to be too much for me, and how am I going to choose a community and also downsize. Sometimes a social worker or a geri care manager can help with those things. Day-to-day management of finances is often something that our folks will struggle with because it's more abstract and a more complex set of tasks. So daily money managers are folks who are certified and they're bonded and insured, and you can trust them to help you with your finances. Sometimes you might only meet with a daily money manager to get online bill paying set up. And sometimes they're going to, if you want them to, they can actually take over the paying of bills or handling of other things. Community nonprofits, agencies, and websites. In Atlanta, we have the Atlanta Regional Commission, and they have wonderful services. Empowerline, at Empowerline, you can call Empowerline and find out exactly what you qualify for in terms of assistance, and what community agencies might be in your neighborhood providing the services that you need. RSVP is one of those services, and they also do have some case management, the Benjamin Rose Initiative, BRI. There are also other nonprofits like Jewish Family and Career Services that runs the Age Well phone line, and they have a lot of programs that they administer the grant funds for, and they can help determine what you may qualify for in those. So I don't know if you saw the slide at the beginning that I sort of glossed over. One of the pictures was of a mailbox full of these chunky cartridges. So what that is a program called GLASS, and it's the Georgia Library for Accessible Statewide Services. Georgia, yes, Georgia Library for Accessible Statewide Services. And they have thousands of books and magazines, and these are basically audiobooks or talking books. And if you are a person who has difficulty reading traditional books because of changes in your brain, then you will qualify to get the device that plays these chunky cartridges. And they're super simple to use. They have a go button and a stop button. And these cartridges come pre-labeled, so they're very easy to just drop in the mail, and they'll send you a new one when you're done. So I strongly recommend the Georgia Library for Accessible Statewide Services. And moving along, the Dementia Action Alliance is a wonderful organization. Their mission is to reduce the stigma and to help people with a cognitive impairment live their best life. They have a speakers bureau and podcasts and mentor programs, and they have a wonderful website at daanow.com. So I strongly recommend checking that out. They have a program, a form that you can download called What Matters to Me. And it's a way of kind of letting people know what's most important to you and of figuring out for yourself what your priorities are now and looking ahead. So I do recommend checking out daanow.com for the Dementia Action Alliance. Lots of Helping Hands is a website or an app. And this is a way that the people who are helping can organize so that they're not repeating efforts, and so that the help that they're providing is actually useful. There's almost nothing worse than getting 5 lasagnas and no one to help warm it up and do the dishes. So using this care calendar, tasks can be assigned to the support team. Different people can add tasks if they know of a need, and different people can claim tasks if they have the availability to provide a ride to a certain appointment. And everyone can stay up to date with what's going on and send fond wishes. And it's a really nice example of a good app to have. The Alzheimer's Association. So I know that the name is off-putting. And what I want to say about that is, please give it a chance. Please don't be put off that the very first word is Alzheimer's, and you or your loved one may not have an Alzheimer's diagnosis, or it's got a lot of stigma associated with it. The Alzheimer's Association's vision is a world without Alzheimer's and all other dementias. And their programs are fantastic for all kinds of folks who are experiencing neurological issues of one type or another, including those that are really very mild. So I do encourage accessing the Alzheimer's Association information. They have support groups and advocacy opportunities, as well as a 24/7 helpline. So if you have a panic at 2 o'clock in the morning, they're there for you. So is the website. And I strongly, and this is one of those that I mentioned for those of you who might not be local to the Atlanta area, the Alzheimer's Association at alz.org. You can find the chapter near you. So I am interested to know what some of the barriers folks have faced to using services are, or how you have overcome them. I'm interested to know other useful services that you might share with our community. And that's all I have, other than the last very silly slide. And I did not put this here. This I blame on Suzette.
Thank you, Debbie. This was a great talk. Does anyone have any questions about anything that we spoke about specifically? Was there any topics that maybe weren't covered that you have any questions about? Please post them in the chat or in the Q&A, and we'll be happy to talk about them. And yeah, so Debbie, you also mentioned that there was a few slides that got changed, but due to our technical difficulties, we kind of lost. Is there anything else that you wanted to add that maybe we don't have a slide for?
So it wasn't so much that there were different slides. I think I just had added some contact information for a few different things. So if there are things that people especially want or need, you know, I would invite people to email us at empowerment@emory.edu. And we'll be happy to help in any way possible. But
that reminds me of one other announcement I forgot to make at the beginning. So if anyone does email us at empowerment@emory.edu, please put somewhere either in the subject or in the body of the email that you're talking about CEP Live. And just that way it gets routed to the right person. There was a few times where people have emailed and being like, hey, what about this? And our receptionist wasn't sure what they were talking about. So just to prevent any delays in communication, please make sure to just mention CEP Live somewhere, and it'll get routed to the right person. In addition, so I already have uploaded the PowerPoint that has some of that contact information in our Google Drive. So I just posted that in chat if anyone would like to look at the PowerPoint. And so as far as Debbie's contact, the best way to get in contact with us here at the Cognitive Empowerment Program is to do exactly what Debbie said, which is email us at empowerment@emory.edu. So that's EMPOWERMENT@emory.edu. And just say, hey, I was in CP Community Live and I have a question for Debbie or Matt or whoever, and it'll definitely get routed to the right person. Does anyone have any other questions about anything that we talked about today? Does anyone have any experiences that they would like to share with us regarding some of these services? Yeah.
So one thing I think is a common misconception is that most of us believe and hope that Medicare will cover a lot more than it actually does. When you're considering looking at services, you know, how you're going to budget for those or fund those things might be an important conversation to have. And if you do have a primary care doctor in Emory Geriatrics, you have access to a social worker. If you have a neurologist, here you have those social workers. And if you don't have a social worker in your life, then definitely the Alzheimer's Association or empowerline.com, you know, they can certainly help you to navigate who pays for what.
Yeah, that's a great point. Yeah, so I wanna mention Lyft, some more details about Lyft and Uber. So someone just had some really great points. And so first of all, if you've never heard, I mean, we talked about Lyft and Uber earlier, but Lyft and Uber, as a refresher, are these, it's kind of like a taxi service, so to speak, that you can use your smartphone to say, like, I am here, this is my location, I would like to go to this location. And someone will drive up and pick you up and they'll bring you there and you'll be able to pay for it through your phone because you have to upload your payment information. Some tips on some lesser known features. So obviously, one, you definitely have to add like your credit card information or however you're going to pay for the app. But additionally, some other neat features is you can have other people send a car. Okay, normally when you use Lyft or Uber, it's picking up yourself, but you can use Lyft and Uber to send a car to pick someone else up. So as an example, my parents live in Massachusetts, and if for some reason my parents' car broke down, I could actually open up my phone and send a car to their location and then that drive them to another place. And I can do that from my account, and it doesn't matter if they don't have Lyft or Uber on their phone or not. So that's one thing that can be really helpful, especially if you're in like a caregiver situation where, again, you're not physically there and you need to send a car to go pick someone up to bring them to another location. Another thing that a lot of people don't know about is there's a lot of hidden safety features that are really neat, and these are within Lyft and Uber, where you can make it so anytime you use Lyft or Uber, it will send a text message or a notification to a loved one that you set. So as an example, if you have a spouse, every time you use a Lyft or Uber, it could send a notification to your spouse saying, hey, I'm about to get in a ride from here to here. And if you click this link, you can actually watch on a GPS screen my car moving, just in case if you're ever worried about a driver bringing you somewhere that you didn't want to go. And yeah, that's a really neat feature that I think a lot of people don't take advantage of.
In fact, Matt, the same is also true of the meal delivery and grocery delivery services. So, you can, I could do the grocery shopping for my relatives who are in California and choose the day and time in their time zone to get the food from their local grocery store, the things that they want and need most frequently. And a lot of people are doing those things, which really boggles the mind and makes for a small world and a lot of help.
Yeah, I've actually have a lot of experience of that also with like gifts and stuff. Is that how you can like send flowers that way? You could send alcohol now, like you can send like all kinds of things like over the internet to other places from a local business. So yeah, there's all kinds of options out there for gifts and grocery stores and transportation and all kinds of stuff. So
yeah.
Yeah, does anyone have any other questions or comments regarding any other services that are here locally in Atlanta, or maybe some things that are national, maybe some digital things?
So I also realized one of the changes that I had made to the original the PowerPoint was in talking about in-home services. There are different programs, some of which might focus more on the identified patient and what their care needs are, and other programs and grant funding might focus more on the care partner and in helping them to be less overwhelmed and more supported. So be aware that there are grants that provide for respite care just to give care partners a break. And there are also programs that provide care because somebody needs it and doesn't have anybody to care for them otherwise. So, sometimes the care recipient might not be low enough income or whatever to qualify for a particular service, but there might be monies available if you come at it from the angle of giving care partners support. So it does pay to be creative and to be working with somebody that kind of knows their way around this stuff.
Yeah. I see a few comments coming in. So someone mentioned that that they enjoyed a lot of programming at the North DeKalb Senior Center before the pandemic, and that they're trying to continue on Zoom, and they're still coordinating delivery of for meals to the senior center. And that the DeKalb Office of Aging also coordinates transportation services for senior center members to see doctors. So that's really useful information. Thank you for sharing that.
Mhm.
If anyone's in that area, hopefully you can take advantage of this. So this has been recorded and it will be uploaded to YouTube. I will post the link to our YouTube channel that's also shared with Brain Talk Live in a moment. I shared it earlier, but I'm happy to share it again and I'll post it in chat. Does anyone have any other questions or comments? Does anyone have any other tips or things that they have found really useful? Okay. Well, I don't see any other questions or comments coming in. So what I think I'll do is we can end a little bit early today. I am going to keep this link open. If anyone has any last minute questions or comments for me or Debbie, I want to thank everyone for coming. Next week, now again, this is tentative, just similar to this week, how we did have a change in schedule, but tentatively, at least, we are scheduled to have functional independence here. So that will be either Maureen or Tracy, or it could be some of the researchers that we're working with. We have a lot of great occupational therapy research going on or starting up here in CEP. So please stay tuned for that. I'm not sure exactly what the topic is going to be, but look forward to that. And yeah, so I want to thank everyone for coming, and thank you, Debbie. It was a great presentation, and see you guys all next week.
Thanks.
Bye, everyone. Like I
Bye.
said, I'm gonna leave this link open just if anyone has any last minute questions or comments. Okay. Bye, everyone.